Good morning, everyone. Good morning. Good morning. Thank you all for being here this morning so we can talk about maternal health. I want to thank President Preckwinkle for joining me here today, as well as the other commissioners who are joining us to hear Commissioner Degnan, Commissioner Daly, Commissioner Britton, Commissioner Lowry, and Commissioner Trevor. And we also have Dr. Lamar Hasbrook here from Cook County Department of Public Health. So last year, I sponsored a resolution to have a maternal health hearing due to the appalling maternal morbidity and mortality rates and unacceptable disparities, especially for Black women, that was only made worse by the pandemic. That was almost 1 year ago today, and we learned a lot at that hearing, but in order to keep this issue front and center, I knew we had to again sponsor a resolution to have a hearing to get an update on the progress that we've made over the last year and the steps we need to take and continually work on to improve maternal health outcomes for all women. This has been a decades-long issue, and we will not see more respectable outcomes unless we keep this at the forefront of what we do at the county, at the state, and federal levels. What is so tragic and that we keep hearing over and over again is that up to 91% of maternal deaths are considered to be preventable. It is my hope that with this hearing, this will allow us to see where we are in the process of finding solutions to improve these numbers in Cook County and across all of Illinois, such as the creation as the Cook County Health Doula Program, which I secured $1 million in the health system budget, working with the Cook County Health leadership and the support of the county board. According to a 2021 report from the American College of Obstetrics and Gynecologists, continuous one-to-one emotional support provided by support personnel, such as doulas, is associated with improved outcomes for women in labor. Doulas can provide individually tailored, culturally appropriate, and patient-centered care and advocacy. However, only about 6% of women who give birth receive a doula care. At Cook County, we are changing that dynamic by standing up a Cook County Health Doula Program, which I expect to hear about later today in the hearing. I would like to see a coordinated plan developed with the cooperation of Cook County Health, Cook County Department of Health, Illinois Department of Health, and our private partners and hospitals to reduce these numbers even more. I look forward to today's hearing to get an update on the data and to examine the maternal health crisis and see how we can improve outcomes for all women in Cook County in Illinois. So thank you all for being here. I'd like to turn it over to President Preckwinkle for remarks. After President Preckwinkle speaks, if you want to help us guide us so each commissioner could have a few words. Thank you.
Thank you, Commissioner Miller, and good morning, everybody. Good morning. I appreciate, Commissioner, you bringing us together today and for your leadership as we highlight an issue that demands our urgent attention, maternal health. I'm also pleased to be joined by Chairman John Daly, Vice Chairman Bill Lowry, Commissioner Bridget Degnan, Commissioner Maggie Trevor, and Commissioner Scott Britton and Bill Lowry. Did I get everybody? Okay, all right, good. Also, we're grateful that Dr. Lamar Hasbrook, who's Chief Operating Officer for Cook County Department of Public Health, has joined us as well. And we're also joined by Commissioner Anaya. Thank you very much, Commissioner Anaya. Your support underscores the collective commitment of Cook County government to address this critical issue. At Cook County, we stand united in our mission to improve maternal health and access to care. This commitment to care and equity is deeply embedded in the mission of Cook County Health, which for more than 180 years, almost 2 centuries, has provided high-quality care for expecting families, women, and children. As part of that commitment, Cook County Health has welcomed all who come through its doors, all. Our dedication to equity means that we're dedicated to solving problems affecting under-resourced communities. It also means providing equitable access to care for residents, regardless of race, ethnicity, religion, zip code, or ability to pay. As commissioners delve deeper into the discussions of maternal health at today's meeting, let's be reminded of the stakes involved. These are our mothers, our sisters, our aunts, our daughters, our family members. These disparities in maternal mortality and morbidity across Cook County and across the nation are unacceptable. It's imperative that we continue to harness our collective expertise and resources to forge pathways that will lead to better health outcomes for all mothers in all communities. Now, usually we do this by asking the chair and the vice chair to speak, that is the chair and the vice chair of finance to speak first. But since this is a women's issue, we're going to ask the women to speak first. We'll start with Commissioner Degnan, Commissioner Trevor, Commissioner Anaya, and then we'll come this way. Okay? Let's start with Commissioner. Thank you.
Thank you, everybody. Well, first, thank you all for being here. My name is Bridget Degnan. I'm the Cook County Commissioner in the 12th District, which covers parts of Chicago's north and northwest side. And I want to thank our County Board President, Tony Preckwinkle, and Commissioner Donna Miller first for having this press conference and bringing this really important topic to light. As you may not know, the United States has a maternal mortality rate many times greater than that of other industrialized nations. And the COVID pandemic only served to worsen this crisis. In 2021, we saw a 40% increase in maternal deaths, representing the deadliest year for pregnant women and mothers since 1965. The pandemic contributed to a quarter of all maternal deaths in 2020 and 2021, and will continue to have negative effects on maternal health for years to come. What the pandemic has further shown us is that there's a heightened need for more comprehensive and accessible maternal health care, particularly for Black and African American women, who have rates of maternal mortality greater than double that of non-Hispanic white women. The maternal death rate for Black and African American women rose from 44 per 100,000 live births in 2019 to 69 in 2021. Additionally, there are wide disparities in adverse maternal outcomes like preterm birth and low birth weight. These potentially life-threatening conditions often cause long-lasting health problems for mothers and children and have had a disproportionate impact on Black and African American women and families in the United States. Statistically, in Illinois, Black and African American women fare no better in pregnancy outcomes than those nationwide. Women in Illinois who have no prenatal care had a severe maternal mortality rate 3 times that of women with access to prenatal care. Providing equitable access to prenatal care in Illinois would reduce maternal mortality and close the gap between white and non-white mothers. Possibly most disappointing is that over 90% of maternal and pregnancy-related deaths in the United States are preventable. But alternatively, this also means that with greater access to prenatal care, we can work to prevent maternal deaths and ensure mothers are able to seek the care they need and be with their families. The maternal mortality crisis in the United States is way too often overlooked, and it is alarming that there has not been more done, especially as mortality rates continue to increase. My colleague, Commissioner Miller, has championed an effort to fund doula services at Cook County Health. Doula services are just one of the many ways we can improve maternal health outcomes and provide advocacy for mothers during their pregnancies. With Mother's Day just having passed, I want to take a moment to recognize the mothers who could not be with their children and promise you that here in Cook County, we are working so hard to increase our maternal health resources so that more mothers live to see their children grow up. Reducing maternal mortality starts with raising awareness about contributing factors and providing resources and access to comprehensive prenatal care, something we're doing today. I applaud Commissioner Miller for her work on this issue and look forward to contributing to her mission and Cook County's mission to expand maternal health services here in Cook County. Thank you.
Commissioner Trevor, did you want to say a few words?
Good morning.
Good morning.
I'm 9th District Cook County Commissioner Maggie Trevor, and I also want to thank my colleagues and especially thank Commissioner Miller for bringing this issue, being a champion for this issue. The alarming statistic that 91% of maternal deaths are preventable, I think is in some ways just one part of the story. Proper prenatal care not only makes for lower death rates, it makes for better outcomes on many levels. It means that families, mothers, children essentially get the right start in life, and it helps families get on the right foot in terms of health care going forward. It helps those children get a good start in life. So I want to applaud the efforts of Commissioner Miller, and I'm glad to be able to be a part of this. Thank you.
Commissioner Naya?
Good morning, everyone.
Good morning.
Alma Naya, Cook County Commissioner, 7th District. I represent the southwest side of Chicago. As the Vice Chair of Health and Hospitals Committee, I join my colleagues in thanking Commissioner Donna Miller for her advocacy, and also thanking the President's Office for noting how important this issue is. You know, the shocking but the truth reality of the statistics, even some that were shared by Commissioner Degnan just right now, should be a rude awakening. I don't really understand how we can see a demographic suffer so much, putting literally their bodies on the line to continue, our earth and having and playing this important role in humanity. But seeing these disparities and understanding that us in Cook County having a health system, having a safety net, just sit back and not do anything. So we know that Cook County has been leading, and we understand that the role is important here because the women, the Black and brown women coming to our health system depend on us. And we understand that we must do something about it. And we must do much more to close those gaps because they still exist here in the state of Illinois and in Cook County. So I join with full support around this issue and hope that we continue to not only advocate, create awareness, but create real access and real change in the long run. So thank you so much for having me today.
Thank you. Thank you. I would ask the Chair of Finance, the Vice Chair of Finance, and Commissioner Scott Britton to speak, and then Dr. Hesberg.
Thank you very much, Madam President. Dr. Donna, let me congratulate you on this resolution. And also let me thank you for your leadership on this. We've been exchanging a lot of emails and texts on this issue. Madam President, let me thank you, the Cook County Department of Public Health and Cook County Health for the services that you outlined what they provide. These numbers are not acceptable. Hopefully, between the federal government, the state, and the county, and the state, we can come together, as we did under the leadership when we did during COVID, working together. These results must change, and where there's a will, there's a way, and there's definitely a will on the administration and Don and the board. Thank you. Yeah, Bill.
Thank you very much. I'm Vice Chair and Cook County Commissioner Bill Lowry. I represent the 3rd District. I want to first say thank you to my dear friend and colleague, Donna Miller, for bringing this just so very important issue to all of us. Thank you, President Preckwinkle, for your support. Doctor, thank you to you and CCH for everything you're doing relative to access for care. I was born October 21st, 1962. And the next day, my mother was alone with me. I might have still even been in the hospital, but she had acute pain. And she called 3 or 4 different ambulance services. And none of them would come and pick her up from her apartment because she was a Black woman living in a Black community. She was ultimately able to be lifted to the hospital by family friend Spencer Leak in a hearse because Spencer Leak owned a funeral home. Had my mother not gotten to the hospital that day where it was determined placenta had been left in her, she would have died. And here we are 61 years later, still talking about this issue. We can do better, we must do better, and because of colleagues like Donna Miller, we're going to do better. Thank you.
Thank you. I am Commissioner Scott Britton of the 14th District, representing the northern suburbs of Chicago. And again, I also thank my dear friend and colleague, Commissioner Miller. And Commissioner Lowry, I can tell another story that's very similar to your own. In September of 1996, I got a call from Evanston Hospital that my wife was in labor. Her blood pressure was 225 over 125 because she'd suffered from preeclampsia. Doctor, I think you can tell us that's not good. And I can also tell you that I have a beautiful 27-year-old daughter who's here today in substantial part because of my zip code and the fact that I had insurance coverage that was going to make sure that everybody was taken care of. And they were. It is not acceptable to me that there are still people in this county who do not receive the same care as we would receive in the northern part of Chicago based on economic and racial disparities that continue and that must be addressed. I believe that Commissioner Miller is leading this charge in a very real way with real consequences and real change, and I'm proud to be part of it. I do have a committee I have to run, so I'm going to go do that right now. But again, thank you to my colleagues and Commissioner Miller in particular. Thank you so much.
Good morning, everyone. Good morning. So why do they die? They die as a result of violence, of drug use. They die as a result of depression and suicide. They die because of complications of pre-existing chronic diseases. They die because they don't know the signs. They die because their providers don't listen to them. There's a number of reasons why they die. So pregnancy-associated deaths is a public health priority, not because tens and hundreds of thousands of pregnant people and women die every year, but because, as has been mentioned, it is preventable, almost 90% preventable. It's a problem because 2 to 3 times as many black women die within 1 year of pregnancy as compared to others. That's why this is a problem. So as with many public health priorities and challenges, it must be a data-driven, data-led approach. And so with that, I want to recognize and appreciate the maternal mortality review committees at the state level, the many hospital-based review committees throughout Cook County and throughout the state that delve into these stories and track the life-threatening complications of morbidity related to pregnancy. They help to unearth those opportunities for prevention. They help to unearth the risk factors and the preventive factors and help to inform all of the things that we do going forward. We at Cook County Department of Public Health want to continue to contribute to the body of knowledge by expanding the data that we collect. Currently, we collect 4 indicators of maternal and child health. We're going to be expanding those to 15 indicators by the end of this summer because we understand that better data leads to better knowledge, leads to better outcomes, leads to better prevention strategies if we can translate that data into action. So we're happy to be a part of this. Again, Commissioner Miller, thank you for championing this, and President Preckwinkle for your ongoing support. Thank you.
So thank you all. I just want to say we've heard from so many people, and these impactful stories, even on the personal level, mean so much to this fight for maternal health and the fight for women's health. So thank you, Dr. Hasbrook, for focusing on the data, and we will continue to focus on data. And thank you to all my colleagues who are also focused on making sure that this effort goes in a positive direction and we can improve outcomes. Thank you, Madam President, for the work that you are going to help us do and continue to help us do through the hospital system. We have the tools and the technology to make this better. And with all of us, I know it will happen. So thank you all for being here today.